Hello, good day. This is Dr. Zaid. I am here to explain to you about how to approach the developmental station. Let's start. So, in the exam, there will be 2 minutes of reading scenario outside the station. And in these 2 minutes, you must be quick, smart, and targeted to what you want to do. So the scenario in this case is 5-year-old boy brought by his family because they are concerned about his developmental milestones achievement. The tasks are: take a focused history, watch the video displaying the developmental milestones of the child, answer the questions provided by the examiner, and discuss the diagnosis and management plan with the examiner. In these 2 minutes, prepare yourself in the developmental station. You will write on a paper because in the exam they will provide you with papers. Okay, so in this paper you will be writing this cross. In the cross you will write the developmental milestones: gross, fine, speech, and social. And on the side of the paper you will list your tasks. The first important task: introduction. It has marks, so don't forget to say hi, introduce yourself, and I have a separate video explaining exactly what to say in the introduction in most of the stations. Then you will take a focused history. Focused history, it will go around the problem, around the concern, and related to the concern, and it must be quick, focused, and it should not take more than 3 minutes, because in the exam it is 10 minutes station once you enter the room. So you will have 3 minutes for taking history, and nobody will tell you to stop. Just take a focused history and program yourself to take a full focused history in 3 minutes. Then there will be 2 minutes for watching the video. So you will take the focused history, you will watch the video, you will tell your findings, and after that, before telling the estimated age, if you felt that you need to know more about the history, you can quickly ask about the rest of the history, and after that you can say the estimated age and your investigations and management plan. So now your 2 minutes finished, and you will hear a ring, you will enter the room. So in the room, there will be usually one examiner physical and one online examiner. Okay, this is the current exam. And there will be the surrogate mother that you will take the history from her, and a computer to see the video. So in our scenario, you took the focused history. You must ask, I will outline before going to the video. I'll outline to you what you will be asking. You will be asking about the age of concern. You will ask about when it started, the early developmental history, perinatal history, past medical history, surgical history. Did he do hearing test? Is there any regression in the development? Is there any family history of developmental disorders? What about the social history and the school performance? What about the behaviors? So by these questions, you will know the main problem, you will know the concern. Okay? Plus, if the mother said there is a problem, for example, in the speech, or there is a problem in, just explore a little bit more so you will have a big picture. For example, for speech and language, she said in this scenario that the child could not tell full stories, only 2 to 3 word sentences. Not all speech is clear. Back and forth conversation is normal. Remember, in the scenario, the child is 5 years. The social and emotional, the mother mentioned like he likes to play, pretend and imaginary with other children of his age, and he has many friends. And for the gross motor, the mother mentioned he can go upstairs adult fashion but downstairs one step, and he can squat and he can ride a tricycle but not pedalic bicycle. Okay, so after that you will be watching the video. In the video you saw a boy. Please note, if you saw any dysmorphic features like Down syndrome, features of Fragile X, just mention that you are noticing some dysmorphic features. Plus, in this video, we saw a boy. He is holding the pencil in. Okay, wait a minute. Okay, so he is holding the pencil in a tripod grasp, not full tripod grasp, and he could draw a circle, he could not draw a triangle, and he scribbled horizontally and vertically. Plus, he could build a tower of 10 cubes. Moreover, in the speech, he could say his full name, he can say his gender and the address. So in your paper, this is how it look like. You will put everything you watched in the video and the mother told in the history under each category. So it will be easier to you to identify the problem and to tell the estimated age. So you will tell the examiner two things now: whether the child is having a global developmental delay or a specific motor delay. Plus, you will tell the estimated developmental age, which is in this scenario 3 years. Now, before moving to the investigations, you will mention about the complications about this developmental delay. You will tell the mother, you will tell the examiner that this child is having developmental delay, and this might affect activity of daily living skills such as feeding, dressing. It can has communication difficulties. The child can have school problems, and the child can have behavioral problems. So after that, you will mention about the investigations. So for the investigations, you will mention that you want to do hearing and visual assessment, thyroid function tests, molecular genetic testing for the Fragile X, and metabolic screen. Plus, you want to do the IQ test and the developmental assessment. The examiner will ask you, what are your differential diagnoses? So you will mention that since the child is having developmental delay, I will put genetic disorders at the top of the list. It can be Fragile X, maybe Duchenne muscular dystrophy, especially if he has in the history or in the video that there is gross motor. So you will mention Duchenne muscular dystrophy based on intellectual, speech, and gross motor delays. And if there is in the perinatal history that there is asphyxia, so you will mention that my third differential will be hypoxic ischemic encephalopathy. So then the examiner will ask you what you are going to do, what is your management plan. So you'll answering that I will refer the patient to the speech and language therapy. I will refer for developmental pediatrician and pediatric neurology doctor, plus rehabilitation center. Plus, I will refer the patient to do physiotherapy and occupational therapy. And expect at the 7 minutes that there will be a knock on the door to tell you that there are 3 minutes left, and after that, when the station finishes, you will hear a ring again. Now I finished my presentation. Thank you for watching this and listening to this. I hope it will benefit you, and best of luck in the exam. Thank you.